Yeonsu Declaration for Learning Cities, building healthy and resilient cities through lifelong learning. Preamble, Article 1.
We, the mayors, deputy mayors, officials and representatives from 229 learning cities in 64 countries worldwide, education executives, education experts, representatives of UN agencies, the private sector, and regional, international, and civil society organizations have convened both online and in person in Yeonsu, Republic of Korea, from 27 to 30 October 2021 for the 5th International Conference on Learning Cities, ICLC, dedicated to building healthy and resilient cities through learning.
Article 2.
We gathered during an unprecedented crisis that emerged due to the COVID-19 pandemic, which endangered the health of populations and forced governments around the world to close learning institutions, affecting nearly 1.6 billion children and students in more than 119 countries and countless adult learners, with a profound impact on mental health and well-being.
Article 3.
We underline that with more than half of humanity living in urban areas, cities have a key role in promoting learning for health and strengthening resilience.
Article 4.
We recognize that the COVID-19 pandemic has hit vulnerable populations hardest and has fueled inequality in cities, exacerbating pre-existing issues as well as giving rise to new forms of inequality, and this requires a collective response through education and lifelong learning to avoid the risk of an even greater increase in health inequality.
Article 5.
We commend members of the UNESCO Global Network of Learning City on their commitment to lifelong learning throughout the COVID-19 pandemic, including the effort to promote health literacy among local population and their capacity to now expand on innovative strategy and program implemented during the crisis.
Article 6.
We convey our gratitude to the mayor of Yeonsu and his city for their leadership as hosts of the 5th ICLC, demonstrating great adaptability and commitment throughout this period of difficulty.
Our commitment to building healthy and resilient cities through lifelong learning. We commit to Article 7.
The political will necessary to place lifelong learning for the health, the development of resilience at the center of our city's agenda, recognizing the influence this has on development within the city, as well as the resonance of such leadership at national and international levels.
Article 8.
Paying attention to the specific contextual factors of each of our cities in order to implement policies and initiatives of learning for health in a way that involves everyone in the city and consider local communities, social and cultural perceptions of health-related issues, including indigenous knowledge.
Article 9.
Implementing in responses to crisis coordinated local plans for the preservation and provision of essential services, including emergency medical services, sexual and reproductive health services, education, public transport, housing, and sanitation.
Article 10.
Working with and empowering local people to develop capacities to protect their own health by providing an array of education tools for the acquisition of knowledge about the virus, transmission prevention, self-protection, and effective use of the healthcare system.
Article 11.
Establishing a new paradigm for learning for health in city, a concept which includes mental health and well-being, and a personal and societal resource for health literacy and citizenship for health.
Article 12,
As a dimension of learning for health, promoting health literacy in the city, meaning that ability to locate, understand, and critically evaluate health information, including through technology, and to apply that information to solve health issues, and supporting local people to identify false information and reduce its impact on health related decision making.
Article 13,
Strengthening citizenship for health in recognition of the wide societal impact of health issues and the common good of global health, giving learners more agency to act with ethical and social responsibility when it comes to their own health and the health of their own communities.
Article 14,
Strengthening resilient cities in terms of community resilience, multi-sectoral planning involving local people, and bottom-up and top-down policies and practices to foster long-term resilience in communities, as well as the resilience of local learning systems, particularly with regard to the continuation of learning in cities during crisis, as well as ways of protecting learning systems in the face of the future disruption through innovation and technology.
Article 15,
ensuring that learning opportunities involve and respond to the needs of the vulnerable populations, including children, understanding that vulnerabilities are often intersectional, meaning individual learners may experience multiple forms of disadvantage at the same time, and that people with lower levels of education often have lower levels of health literacy.
Article 16,
recognizing the contributions of the formal education sector, including schools, universities, and technical and vocational education and training institutions, to learning for health and resilience in cities throughout and beyond the COVID-19 pandemic, namely their adaptability in ensuring the continuation of learning and the provision of health education.
Article 17,
building the capacities of local non-formal learning providers, recognizing the positive impact of early childhood care and education on health, as well as the long-term roles of youth and adult learning centers and organizations in creating learning opportunities for health awareness and promoting the use of technology for health literacy.
Article 18,
Making use of informal space within our city for learning for health and to develop resilience include homes, local neighborhood, workspace, green space, public transport, municipality building, and the digital sphere.
Article 19,
Broadening the scope of stakeholder involvement in lifelong learning at the city level so that the health sector is well represented, including health professionals, practitioners, and experts, as well as stakeholders in the field of urban design, in the knowledge that city planning decision impact health and learning.
Article 20,
Strengthening our efforts to achieve the 17 Sustainable Development Goals of the 2030 Agenda for Sustainable Development, and assert the contribution of learning cities to all 17 Sustainable Development Goals, particularly SDG 3, good health and well-being, SDG 4, ensure inclusive and equitable quality of education and promote lifelong learning opportunities for all, SDG 5, gender equality, SDG 8, employment and decent work, SDG 11, make cities inclusive, safe, resilient, and sustainable, and SDG 13, combat climate change.
way forward. Article 21,
We will endeavor to integrate these commitments into local actions and development strategies in order to strengthen learning for health and to develop resilience in our cities, specifically by capitalizing on the recent mobilization of mayors to design and implement post-pandemic recovery plans.
Article 22,
In the transition from emergency to normality, we will capitalize on and preserve the creativity that has emerged during COVID-19 pandemic, including more collaborative approaches to learning.
Article 23,
We will diversify resources, raise funds, and develop financial mechanisms to ensure the realizations of these local actions, development strategies, and post-pandemic recovery plans.
Article 24,
We will conduct a research-based and data-driven review of the city's response to the COVID-19 pandemic in order to learn, listen, and build the resilience in preparation for future crises.
Article 25,
As members of UNESCO Global Network of Learning Cities, we will strengthen the solidarity of the network through knowledge sharing, technology transfer, and the dissemination of good practice in cities at the global level.
Article 26,
We call on national governments to adopt new policies for lifelong learning for health and support the development of resilient cities in UNESCO member states.
Article 27,
We urge UNESCO to reinforce collaboration across its networks, and specifically between the UNESCO Cities Platform and UNESCO Global Network of Learning Cities during the post-pandemic period.
Article 28,
Furthermore, we commit to engaging with the main activity areas of the UNESCO Global Network of Learning Cities as set out in the new strategy of the network.